We offer the Certified Inclusive Fitness Trainer through the American College of Sports Medicine, and it covers a number of different topics like facility design, disability awareness. It covers the ADA and how it impacts fitness facilities and recreational facilities. Safe and effective recommendations for exercise, talks about different types of disabilities and what their contraindications could be to exercise, and we provide that training for them. And I will show just a quick glimpse of what one of those trainings looks like.
Well, welcome to the Inclusive Fitness Training. If you're trying to prevent diabetes or you're trying to work in chronic health conditions, most likely you're serving someone with a disability, regardless if it's physical disability that's apparent or perhaps it's a disability that's hidden. We really do believe that by you taking the time to be here today, that you will be a better professional for all the people that you serve.
Holds that certification and provides the authority over that certification. We do all the trainings. So we go out to different locations whenever it's requested and provide a training on that for the American College of Sports Medicine.
All right, so we have inclusion in policy. Excuse me, in policy. As mentioned, before, policy is a really important piece that should usually be the ultimate goal, right, to help sustain changes and make them long-lasting. So NCHPAD has an initiative called Commit to Inclusion. It started off as a national campaign and then grew to a global campaign. So it is now an international campaign. And oftentimes when organizations or communities are looking to make inclusive changes, this is a really great place to start. Taking the time to make a commitment that you are going to become inclusive. I know I saw, I think one of our friends from Ohio on this webinar, and I know that they've done a wonderful job, and one of their communities got 20 different organizations to commit to inclusion as a start to their work in disability, accessibility, and inclusion. So this is something, relatively simple, but can have a long-lasting impact and start that momentum for true change within your community or organization. Along with the commitment to inclusion, we have 9 guidelines. So if you make this commitment, what you're doing is saying we're gonna look at these 9 guidelines and implement them. And so we have an implementation manual that goes over these 9 guidelines that talk about why do this, how to do it, examples, and other resources. Because again, we like our packages and trying to make everything as simple as possible for people to carry this work out. So we have all of that packaged up in the manual. So just quickly, our 9 disability inclusion guidelines. And this covers some of the stuff that we've already talked about. But we have objectives. Number 1 is objectives include people with disabilities. So these program objectives should explicitly include the target population. So in this case, we're talking about people with disabilities. It should be explicit. So it's, oftentimes we, programs or missions will say, we serve all people. But in this instance, we're saying that objectives need to be explicitly inclusive of people with disabilities, because we know from our work that even when it says all people, people with disabilities are oftentimes forgotten about. The second guidelines is that people with disabilities should be involved in the development, implementation, and evaluation of, for instance, a program or services that you provide. So again, making sure that people with a range of disabilities are involved is a wonderful way to make sure that it's inclusive and accessible, and people with disabilities can share their experiences, and then it can better ensure that your program will be successful and inclusive of people with disabilities. The third guideline is program accessibility. So we've talked about programmatic accessibility, but this just is one of the guidelines. It's explicit about how it can be done socially, behaviorally, programmatically, in communication, and the physical environment. Providing accommodations for people with disabilities. So, accommodations oftentimes are covered, or it's what people think of when they think of the ADA. But again, this is just explicitly stating that they need to be provided, and accommodations should be tailored for the people who you're specifically serving. Again, communication and outreach. Kelly has covered that extensively with the communication and the communication scorecard. But again, using the correct terminology and making sure that people with disabilities are included in the images that you're putting out there, so that they know that they're invited to your program, that they will be included. So that's a really important guideline. Cost considerations and feasibility. This is a really important one that lots of times people don't think about, or they don't think very outside the box. But in that video of MA looking at an accessible facility for working out, she asked some really great questions that I think different programs can consider. Can they get a reduced fee because they can't access everything, or can she have just a trial membership to make sure it's a good fit? And so cost should be addressed, or even having scholarship programs as well as sliding scale. So there's many different ways to address this. Oh yeah, and so here we go, affordability. So kind of covered that with some of the cost issues, but also thinking about how, if a person has a caregiver, even thinking about that, maybe they shouldn't be charged, right? They're not necessarily, say, I'm using the services, but they're just there to help the person with a disability participate. So we need to make sure that the programs are affordable. Then looking at the process evaluation. Process evaluation, some of you who maybe are in public health, or just program evaluation, that process evaluation is really important, because at the end of the day, you might find that you're not very successful in your implementing of an inclusive program, but it doesn't mean that your inclusive program isn't successful, but there might have been a step along the way or a hiccup that made it so that it wasn't successful. So it wasn't that the program wasn't a success, but that maybe you didn't include people with disabilities in the development. And so when you said that you had an inclusive class at 10 o'clock in the morning, well, that doesn't work for people with disabilities who are taking the bus there, because the bus doesn't drop people off until 11 a.m. So those are some things to consider. And then the last one is the outcomes evaluation. So it's really important, of course, to collect that outcomes evaluation to look at what kind of an impact that you're making, but making sure that it is disability appropriate, so that you're truly capturing that impact.
All right, rating booster time. What are 2 important things to consider to ensure that your recruiting efforts are inclusive? We've talked about it a couple times.
So this is just a fill in. So
yeah,
just to fill in. Well, I'll come up with one. So one that I can think of course, I just talked about it, but inclusive images on recruitment flyers.
I would say, if I'm coming up with B, I'm going to say the location of where you put those flyers, or the source that you're using to put out the information. Is it only on Facebook? Do they have access to the web? All of those kind of things. Okay, so the last one, and we're moving quickly because we'll leave time for questions. Inclusion and adaptation and implementation. So when you're actually implementing the program, what we've used, as Perry mentioned briefly just a few seconds ago, is this framework, the grades, so guidelines, recommendations, adaptations, including disability, And this is our framework for adapting those evidence-based programs that we talked about. So those 10 evidence-based programs, actually right now we're probably up to about 12. But it's a framework that hopefully can be used on any evidence-based program or guideline to make sure that it's inclusive of all. We also use it as a tool, making sure that it's an inclusion guideline strategy to make sure that we're including all those parts. We also use it as a set of inclusion and adaptation recommendations by using those 5 domains that she already talked about. So we use the built environment, equipment, services, instruction, and policy. So we may have gotten a program that we adapted and maybe it didn't even list one of these at all. And so that's when it's our job to make sure that I'm reviewing this program with the lenses of all 5 of those domains so that we can be sure that it truly is inclusive to anyone with a disability who chooses to use it. Some of our knowledge adaptation examples. So these are 10 of the programs that we adapted, in case you're wondering. Girls on the Run, Spark After School Program, the Aquatic Exercise Association, Arthritis Program, the CSPAP, which is a physical activity for youth. Weight-wise is another one that's pretty widespread and well-used. Prevent T2, we already talked about. Catch is another after-school program, just like Spark. We adapted both of those after-school programs. BMI Squared is a motivational interviewing program. Go for Life is a senior adult program, exercise program that we made inclusive. SnapEd, Toolkit, which is again another one, and we're implementing now in South Carolina. So those are the 10 evidence-based programs that we have adapted. And then, Carrie?
Yeah, and I'm not going to overwhelm you with this, but basically this is our what we call the NCHPAD I Can Implement process. It's 3 stages and 15 steps. And this is an evidence-based process that is used widely in the medical field and lots of different implementation science research. But basically, these are the steps that really need to be used and carried out to tailor a program to the local context. So you can have an evidence-based program like Catch or Spark, but implementing it in your community, whether it's rural or big city, is a different story. And it may look really different from the research that was originally conducted on it. And so this process is all about aligning that program to the local context and then implementing it and evaluating it and sustaining it within a community. And if anyone has any questions or wanted more information about this, I'm happy to follow up or follow up with me. I'm happy to talk to you about it via email or a phone call.
So we know that in order to implement all these programs and all these resources that we've talked about, we have to have strategic partners. So again, I already talked about the 19 states, and we consider those guys definitely partners. That's actually an old map up there. But these are just a list of some of our other partners, and just to show you ways that we found that help us implement the program. So we create this great product, but if we don't want it to just sit there and not have anybody know about it, and so we found that by having these partnerships, it really helps us to kind of get that information out there. So now we're going to ask if you have changed your definition or description of inclusion in any way, and you can think about that while folks are writing in their questions. And I'm going to stop my screen share just so that we can see the typed in questions on there. So feel free, think about your inclusion strategies or your inclusion definition, and if you've changed that at all, and then let us know if you guys have any questions for us. We'll give just a few more minutes to ask your questions. If you're typing them in, we'll give you a second to type them in. You can also unmute yourself, and then we can hear your questions as well.
Hi, everybody. This is Lindsay. I just wanted to follow up the presentation to remind everyone that as a local resource that I am with Project Cheer and with the CDC funding we received, this is the first time that Kentucky's received this funding. Actually, the map that was just on the previous slide was an outdated map. Kentucky wasn't highlighted in that. Yeah. So this is we're finishing up our second year. And we've already made some incredible partnerships and foundations, and we've done a lot of work towards promoting inclusive health across the state. So being able to bring NCHPAD here, even virtually, is an incredible resource. And we actually brought their director, Dr. Jim Rimmer, to Kentucky Public Health Association conference on Wednesday to be the plenary speaker. And as he was talking, he was saying how incredible of a resource it is for there to be someone, and my team, everyone that I work with, and the partnerships we've created sitting in the state of Kentucky to be able to be that resource right here in town for you guys in talking about and implementing these inclusive health strategies, because we saw a lot of great resources today. But I don't want you to feel overwhelmed in trying to implement that or feel as though you want to do it, but you don't know where to start. And so I just want to encourage all of you that are on today, in addition to knowing what NCHPAD has and how you can reach out to them, but making sure that you also to reach out to myself, and you can do that through my contact information. I'll include in the chat box here, but just making sure that we're working together to promote inclusive health within Kentucky.
Yeah, thank you, Lindsay. So we just saw that question come in. It says, do you find that most community wellness opportunities allow caregivers to participate free with the person they are supporting? Carrie can answer after if she wants. We've had this question a number of times at NCHPAD, and there isn't a specific law in it, but it's assumed. So as long as the caregiver is not participating independently, yes, they are typically provided for free. So if they're literally just going in there to assist the person with the disability, then they should have free access to it. Now, if they are going into the facility, maybe setting that person up on something and then leaving to go work out themselves, then we think it's probably okay for that to be charged a fee or a sliding scale fee maybe. So I think it somewhat depends on, is that person truly just the caregiver and that's all they're doing? They're not using anything in there themselves, or are they helping that person but then they're also participating themselves? And you can change that up a little bit.
Yeah, and I think that, you know, for some of the community wellness opportunities that maybe haven't encountered this issue or encountering it for the first time, you know, sometimes it does take that education and working together with them as a partner to make that change, so that is something that they will provide, is allowing the caregiver to attend that program for free if their only role is the caregiver and they're not participating as well. I know, you know, so like when MA in our video that we showed earlier about finding, say, the inclusive but the fitness facility as the example, she asked the questions about the price and the cost and whatnot. And so, and the woman responded like it was something that they had never encountered. So again, you know, it's about educating and working with them and communicating to make some of those changes. And I think most places are very willing and open to that, right? If you're communicating together and educating them.
And then just depending on what the question is, wellness opportunities could be different. If it's something like the DPP program, we've had questions there too, because technically they're sitting in the room and they're getting all the same exact information that someone who's participating in the program is. And so that might be a little bit different. But if they're not participating in themselves, you know, typically they should be granted access for free.
All right, any other questions? I just want to say before we sign off, you know, thank you to Lindsay for this opportunity, and yeah, we definitely look forward to working with you guys. I know Dr. Rimmer said some wonderful things about what you guys and what you're doing, and so definitely look forward. Hopefully we meet in person one day.
Yes, that would be wonderful.
One more question came through.
Can you recommend universal design tools, picture libraries, or video making platforms? Video making platforms, it's all on your videographer's side, so you can do the research online. And there's also there's new law around media as well. But if you just do the research, whoever is making the video, your videographer should be able to implement it pretty easily, from things like audio description to in a picture. Can you talk to picture libraries, Carrie? I don't know.
So, well, yeah, you might not have a videographer, right? Depending on your
If you're making videos, yeah.
Yeah. So, I mean, but I actually would need to look that up. But like whether you're making it on your iPhone or through your computer, like what resources there are from closed captioning.
So if you produce it, it depends on if you use YouTube, it'll automatically close caption for you, and it may not be 100% accurate, but you can go back in and change their species. So if you're using YouTube as your way to put it out, then you can already have those species there. Just make sure that they are correct. And then if you different social marketing platforms like Instagram, you can click one little button, and I'd have to like go back through and see how to do it. But once you do that, it'll add the description of all of your posts. So that way, once if you're just using social media as your marketing strategy, you can make that inclusive as well.
And we should actually probably make a video on how to make accessible videos in accessible format.
Yeah, by yourself without a video team. That would be interesting.
But we also, I know through our Commit to Inclusion webpage, we actually have some free pictures that you can access and use. But then also, unfortunately, we actually take a lot of our own pictures that are inclusive or have people with disabilities in them, because oftentimes when you go to those free sites where you can get, what do they call it? I can't think of them.
Like clip art, but not clip art.
Yeah, but the free images that anyone can use, oftentimes they don't show very realistic pictures of people with disabilities, or they look like.
Or in general.
Yeah, right. So we oftentimes end up taking our own pictures of either people we know with disabilities, oftentimes myself or our spouses. So
you should probably saw a lot of photos of my husband today. I'm curious.
Yeah. So I don't have a good answer for the pictures, but if you have more questions about the videos or websites to access for closed captioning and those sorts of things, please email us and we can.
And we get requests for pictures all the time, and we're happy to let people use our photos. Usually all we say is, courtesy NCHPAD at the very bottom, but we're happy to give out our photos for folks that are making inclusive programs.
And just so you know, Boo, also too, the Special Olympics International partnered with the AUCD, which is our University Centers for Excellence in Disability. It's their national organization, and they've created an inclusive health toolkit. And so it is specific to intellectual disabilities, but I know, being a part of their work team, they just are working on finalizing the actual Word document, the actual verbiage of it, and then their next steps we're going to be to create a library of resources. And I know specifically one of those was going to be video, picture resources that were inclusive health. But like I said, that'll be specific to intellectual disabilities, but we all know that a lot of secondary conditions with mobility limitations are experienced with that population. So know that resource is forthcoming, and they're having an inclusive health summit actually this summer at the end of June. So.
All right, well, thank you guys for joining us today. I don't think I see any more questions in the chat, so we will sign off, and we thank you guys for being a part of this today and inviting us to be out.
Yeah, thank you so much for your time, everybody.